Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. With out the way, let's get started.
The nurse observes a client in a group who is reminiscing about his past. Which effect should the nurse expect reminiscing to have on the client's functioning in the hospital? 1. Increase the client's confusion and disorientation. 2. Cause the client to become sad. 3. Decrease the client's feelings of isolation and loneliness. 4. Keep the client from participating in therapeutic activities. The correct answer is 3. Reminiscing can help reduce depression in an elderly client and lessens feelings of isolation and loneliness. Reminiscing encourages a focus on positive memories and accomplishments, as well as shared memories with other clients. An increase in confusion and disorientation is most likely the result of other cognitive and situational factors, such as loss of short-term memory, not reminiscing. The client will not likely become sad because reminiscing helps the client connect with positive memories. Keeping the client from participating in therapeutic activities is less likely with reminiscing. Assessment of a prima gravida client reveals cervical dilation at 8 centimeters and complete effacement. The client has severe back pain during this phase of labor. The nurse explains that the client's severe back pain is most likely caused by the fetal occiput being in a position that is identified as which of the following? 1. Breech. 2. Transverse. 3. Posterior. 4. Anterior. The correct answer is 3. When a client has severe back pain during labor, the fetus is most likely in an occipito-posterior position. This means that the fetal head presses against the client's sacrum, causing marked discomfort during contractions. These sensations may be so intense that the client requests medication for relief of the back pain rather than contractions. Breech presentation and transverse lie are usually known prior to 8 centimeters dilation, and a cesarean section is performed. Fetal occiput anterior position does not increase the pain felt during labor. After a lengthy labor process, a prima gravida client gives birth to a healthy newborn boy with a moderate amount of skull molding. Which of the following would the nurse include when explaining to the parents about this condition? 1. It is typically seen with breech births. 2. It usually lasts a day or two before resolving. 3. It is unusual when the brow is the presenting part. 4. Surgical intervention may be necessary to alleviate pressure. The correct answer is 2. Molding occurs with vaginal births and is commonly seen in newborns. This is especially true with prima gravida clients experiencing a lengthy labor process. Parents need to be reassured that it is not permanent and that it typically lasts a day or two before resolving. Molding rarely is present if the fetus is in a breech or brow presentation. Surgical intervention is not necessary. The cervix of a 15-year-old prima gravida client admitted to the labor area is 2 centimeters dilated and 50% effaced. Her membranes are intact, and contractions are occurring every 5 to 6 minutes. Which of the following should the nurse recommend at this time? 1. Resting in the right lateral recumbent position. 2. Lying in the left lateral recumbent position. 3. Walking around in the hallway. 4. Sitting in a comfortable chair for a period of time. The correct answer is 3. Most authorities suggest that a woman in an early stage of labor should be allowed to walk if she wishes, as long as no complications are present. Birthing centers and single-room maternity units allow women considerable latitude without much supervision at this stage of labor. Gravity and walking can assist the process of labor in some clients. If the client becomes tired, she can rest in bed in the left lateral recumbent position or sit in a comfortable chair. Resting in the left lateral recumbent position improves circulation to the fetus. Assessment reveals that the fetus of a multigravida client is at +1 station and 8 centimeters dilated. Based on these data, the nurse should first 1. Ask the anesthesiologist to increase epidural infusion rate. 2. Assist the client to push if she feels the need to do so. 3. Encourage the client to breathe through the urge to push. 4. Support family members in providing comfort measures. The correct answer is 3. The urge to push is often present when the fetus reaches plus stations. This client does not have a cervix that is completely dilated, and pushing in this situation may tear the cervix. Encouraging the client to breathe through the urge to push is the most appropriate strategy and allows the cervix to dilate before pushing. Increasing the level of the epidural is inappropriate, as nursing would like to have the client be able to push when she is fully dilated. This may occur quickly with a multigravida client. Comfort measures are important for the client at this time, but are not the highest priority for the nurse. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A 4-week-old infant admitted with a diagnosis of hypertrophic pyloric stenosis presents with a history of vomiting. The nurse should anticipate that the infant's vomitus will contain gastric contents, and which of the following? 1. Bile and streaks of blood. 2. Mucus and bile. 3. Mucus and streaks of blood. 4. Stool and bile. The correct answer is 3. The vomitus of an infant with hypertrophic pyloric stenosis contains gastric contents, mucus, and streaks of blood. The vomitus does not contain bile or stool because the pyloric constriction is proximal to the ampulla of Fata. Which of the following would indicate that an infant with a tracheoesophageal fistula needs suctioning? 1. Brassy cough. 2. Substernal retractions. 3. Decreased activity level. 4. Increased respiratory rate. The correct answer is 2. With a TF, overflow of secretions into the larynx leads to laryngospasm. This obstruction to inspiration stimulates the strong contraction of accessory muscles of the thorax to assist the diaphragm in breathing. This produces substernal retractions. The laryngospasm that occurs with a TF resolves quickly when secretions are removed from the oropharynx area. A brassy cough is related to a relatively constant laryngeal narrowing, usually caused by edema. It is not an indication of the need to suction. A decreased activity level and an increased respiratory rate in an infant with a TF are usually the result of hypoxia, a relatively long-term and constant phenomenon in infants with a TF. The nurse is a member of a team that is planning a client-centered approach to care of clients with chronic obstructive pulmonary disease. Using the chronic care model, the team should focus on improving quality of care and delivery in which of the following areas? Select all that apply. 1. The community. 2. Clinical information systems. 3. Delivery system design. 4. Administrative leadership. 5. Emphasis on the acute care setting. The correct answers are 1, 2, and 3. The process of changing a healthcare system from an acute care model to a CCM uses continuous quality improvement methods. The goal of the CCM is to improve the health of chronically ill clients. The CCM identifies 6 basic areas upon which healthcare organizations need to focus to improve quality of care and delivery: health systems, delivery system design, decision support, clinical information systems, self-management support, and the community. This system requires healthcare services that are client-centered and coordinated among members of the healthcare staff and client and the family. CCM does not focus on the administrative leadership or the care in the acute care setting alone. Which of the following assessments is most appropriate for determining the correct placement of an endotracheal tube in a mechanically ventilated client? 1. Assessing the client's skin color. 2. Monitoring the respiratory rate. 3. Verifying the amount of cuff inflation. 4. Auscultating breath sounds bilaterally. The correct answer is 4. Auscultation for bilateral breath sounds is the most appropriate method for determining cuff placement. The nurse should also look for the symmetrical rise and fall of the chest and should note the location of the exit mark on the tube. Assessment of skin color, respiratory rate, and the amount of cuff inflation cannot validate the placement of the endotracheal tube. A client with acute respiratory distress syndrome has fine crackles at lung bases, and the respirations are shallow at a rate of 28 breaths per minute. The client is restless and anxious. In addition to monitoring the arterial blood gas results, the nurse should do which of the following? Select all that apply. 1. Monitor serum creatinine and blood urea nitrogen levels. 2. Administer sedative. 3. Keep the head of the bed flat. 4. Administer humidified oxygen. 5. Auscultate the lungs. The correct answers are 1, 4, and 5. Acute respiratory distress syndrome may cause renal failure and superinfection, so the nurse should monitor urine output and urine chemistries. Treatment of hypoxemia can be complicated because changes in lung tissue leave less pulmonary tissue available for gas exchange, thereby causing inadequate perfusion. Humidified oxygen may be one means of promoting oxygenation. The client has crackles in the lung bases, so the nurse should continue to assess breath sounds. Sedatives should be used with caution in clients with ARDS. The nurse should try other measures to relieve the client's restlessness and anxiety. The head of the bed should be elevated to 30 degrees to promote chest expansion and prevent atelectasis. Transfer data for a client brought by ambulance to the hospital's psychiatric unit from a nursing home indicate that the client has become increasingly confused and disoriented. The client's behavior is found to be the result of cerebral arteriosclerosis. Which of the following behaviors of the nursing staff should positively influence the client's behavior? Select all that apply. 1. Limiting the client's choices. 2. Accepting the client as he is. 3. Allowing the client to do as he wishes. 4. Acting nonchalantly. 5. Explaining to the client what he needs to do step by step. The correct answers are 1, 2, and 5. Confused clients need fewer choices, acceptance as a person, and step-by-step directions. Allowing the client to do as he wishes can lead to substandard care and the risk of harm. Acting nonchalantly conveys a lack of caring. The nurse is caring for a prima gravida client in active labor who has had 2 fetal blood samplings to check for fetal hypoxia. The nurse determines that the fetus is showing signs of acidosis when the scalp blood pH is below which of the following? 1. 7.5. 2. 7.4. 3. 7.3. 4. 7.2. The correct answer is 4. If the fetus is hypoxic, the pH will fall below 7.2 and be indicative of fetal distress. This finding typically requires immediate vaginal or cesarean birth. A scalp pH reading of 7.21 to 7.25 should be repeated again in 30 minutes for assessment of hypoxia and acidosis. To determine whether a prima gravida client in labor with a fetus in the left occipital-anterior position is completely dilated, the nurse performs a vaginal examination. During the examination, the nurse should palpate which of the following cranial sutures? 1. Sagittal. 2. Lambdoidal. 3. Coronal. 4. Frontal. The correct answer is 1. The sagittal suture is the most readily felt during a vaginal examination. When the fetus is in the LOA position, the occiput faces the mother's left. The lambdoid suture is on the side of the skull. The coronal suture is a horizontal suture across the front portion of the fetal skull that forms the anterior fontanelle. It may be felt with a brow presentation. The frontal suture may be felt with a brow or face presentation. A primiparous client who has just given birth to a healthy term neonate after 12 hours of labor holds and looks at her neonate and begins to cry. The nurse interprets this behavior as a sign of which of the following? 1. Disappointment in the baby's gender. 2. Grief over the ending of the pregnancy. 3. A normal response to the birth. 4. Indication of postpartum blues. The correct answer is 3. Childbirth is a very emotional experience. An expression of happiness with tears is a normal reaction. Cultural factors, exhaustion, and anxieties over the new role can all affect maternal responses, so the nurse must be sensitive to clients' emotional expressions. There is no evidence to suggest that the mother is disappointed in the baby's gender, grieving over the end of pregnancy, or a candidate for postpartum blues. However, approximately 80% of postpartum clients experience transient postpartum blues several days after childbirth. The primary health care provider prescribes intermittent fetal heart rate monitoring for a 20-year-old obese prima gravida client at 40 weeks gestation. In the first stage of labor, the nurse should monitor the client's fetal heart rate pattern at which of the following intervals? 1. Every 15 minutes during the latent phase. 2. Every 30 minutes during the active phase. 3. Every 60 minutes during the initial phase. 4. Every 2 hours during the transition phase. The correct answer is 2. Labor is categorized into 3 phases: latent, active, and transition. During the active stage of labor, intermittent fetal monitoring is performed every 30 minutes to detect changes in fetal heart rate, such as bradycardia, tachycardia, or decelerations. If complications develop, more frequent or continuous electronic fetal monitoring may be needed. During the latent phase, intermittent monitoring is usually performed every 2 hours because contractions during this time are usually less frequent. During the transition phase, intermittent monitoring is performed every 5 to 15 minutes because the client is getting closer to birth the baby. There is no initial phase of labor. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When developing a plan of care for a neonate who was diagnosed with an anorectal malformation and who subsequently underwent surgery, which of the following would be most helpful in facilitating parent-infant bonding? 1. Explaining to the parents that they can visit at any time. 2. Encouraging the parents to hold their infant. 3. Asking the parents to help monitor the infant's intake and output. 4. Helping the parents plan for their infant's discharge. The correct answer is 2. Encouraging the parents to hold their neonate promotes parent-infant attachment. Parent-infant bonding is based on a relationship that begins when the parent first touches the infant. Both the parents and the infant have predictable steps that they go through in this process. Explaining that the parents can visit at any time promotes bonding only if they do visit with, talk to, and hold the newborn. Asking the parents to help monitor intake and output at this time may be too anxiety-producing, thus interfering with bonding. Helping the parents plan for the infant's discharge involves them in the newborn's care and is important. However, it is not the first step in the development of bonding. After teaching the parents of a neonate diagnosed with a tracheoesophageal fistula about this anomaly, the nurse determines that the teaching was successful when the father describes a condition as which of the following? 1. The muscle below the stomach is too tight, causing the baby to vomit forcefully. 2. There is a blind upper pouch and an opening from the esophagus into the airway. 3. The lower bowel is lacking certain nerves to allow normal function. 4. A part of the bowel is on the outside without anything covering it. The correct answer is 2. Although a TEF can include several different structural anomalies, the most common type involves a blind upper pouch and a fistula from the esophagus into the trachea. Other types include a blind pouch at the end of the esophagus with no connection to the trachea, and a normal trachea, and esophagus with an opening that connects them. A tightened muscle below the stomach and projectile vomiting of normal amounts of formula are characteristic of pyloric stenosis. A ganglionic megacolon is a lack of autonomic parasympathetic ganglion cells in a portion of the lower intestine. Gastroschisis occurs when the bowel herniates through a defect in the abdominal wall, and no membrane covers the exposed bowel. Which of the following individuals has the highest priority for receiving seasonal influenza vaccination? 1. A 60-year-old man with a hiatal hernia. 2. A 36-year-old woman with 3 children. 3. A 50-year-old woman caring for a spouse with cancer. 4. A 60-year-old woman with osteoarthritis. The correct answer is 3. Individuals who are household members or home care providers for high-risk individuals are high-priority targeted groups for immunization against influenza to prevent transmission to those who have a decreased capacity to deal with the disease. The wife who is caring for a husband with cancer has the highest priority of the clients described because her husband is likely to be immunocompromised and particularly susceptible to the flu. A healthy 60-year-old man or a healthy 36-year-old woman is not in a high-priority category for influenza vaccination. A 60-year-old woman with osteoarthritis does not have a higher priority for influenza vaccination than a home care provider. Which of the following conditions can place a client at risk for acute respiratory distress syndrome? 1. Septic shock. 2. Chronic obstructive pulmonary disease. 3. Asthma. 4. Heart failure. The correct answer is 1. The two risk factors most commonly associated with the development of ARDS are gram-negative septic shock and gastric content aspiration. Nurses should be particularly vigilant in assessing a client for onset of ARDS if the client has experienced direct lung trauma or a systemic inflammatory response syndrome, which can be caused by any physiologic insult that leads to widespread inflammation. Chronic obstructive pulmonary disease, asthma, and heart failure are not direct causes of ARDS. The nurse has calculated a low PaO2/FiO2 ratio less than 150 for a client with acute respiratory distress syndrome. The nurse should place the client in which position to improve oxygenation, ventilation distribution, and drainage of secretions? 1. Supine. 2. Semifowlers. 3. Lateral side. 4. Prone. The correct answer is 4. Prone positioning is used to improve oxygenation in clients with ARDS who are receiving mechanical ventilation. The positioning allows for recruitment of collapsed alveolar units, improvement in ventilation, reduction in shunting, mobilization of secretions, and improvement in functional reserve capacity. When the client is supine, side-to-side repositioning should be done every 2 hours with the head of the bed elevated at least 30 degrees. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The son of an elderly client who has cognitive impairments approaches a nurse and says, "I'm so upset. The primary healthcare provider says I have 4 days to decide on where my dad is going to live." The nurse responds to the son's concerns, gives him a list of types of living arrangements, and discusses the needs, abilities, and limitations of the client. The nurse should intervene further if the son makes which comment? 1. "Boy, I have a lot to think about before I see the social worker tomorrow." 2. "I think I can handle most of Dad's needs with the help of some home health care." 3. "I'm so afraid of making the wrong decision, but I can move him later if I need to. For I want the social worker to make this decision so Dad won't blame me." The correct answer is 4. Expecting the social worker to make the decision indicates that the son is avoiding participating in decisions about his father. The other responses convey that the son understands the importance of a careful decision, the availability of resources, and the ability to make new plans if needed. The primary healthcare provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as the purpose? 1. Assessment of the fetal hematocrit level. 2. Increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. Pressure is applied with the fingers to the fetal scalp through the dilated cervix. This should cause a tactile response in the fetus and increase the fetal heart rate and variability. However, if the fetus is in distress and becoming acidotic, fetal heart rate acceleration will not occur. The fetal hematocrit level can be measured by fetal blood sampling. Scalp stimulation does not increase the strength of the contractions. However, it can increase fetal heart rate and variability. Fetal position is assessed by identifying skull landmarks during a vaginal examination. Which of the following would be the priority when caring for a prima gravida client whose cervix is dilated at 8 centimeters when the fetus is at 1+ station and the client has had no analgesia or anesthesia? 1. Giving frequent sips of water. 2. Applying extra blankets for warmth. 3. Providing frequent perineal cleansing. 4. Offering encouragement and support. The correct answer is 4. The client is in the transition phase of the first stage of labor. During this phase, the client needs encouragement and support because this is a difficult and painful time when contractions are especially strong. Usually, the client finds it difficult to maintain self-control. Everything else seems secondary to her as she progresses into the second stage of labor. Although ice chips may be given, typically the client does not desire sips of water. Labor is hard work. Generally, the client is perspiring and does not desire additional warmth. Frequent perineal cleansing is not necessary unless there is excessive amniotic fluid leaking. A 24-year-old prima gravida client who gives birth to a viable term neonate is prescribed to receive oxytocin intravenously after delivery of the placenta. Which of the following signs would indicate to the nurse that the placenta is about to be delivered? 1. The cord lengthens outside the vagina. 2. There is decreased vaginal bleeding. 3. The uterus cannot be palpated. 4. Uterus changes to discoid shape. The correct answer is 1. The most reliable sign that the placenta has detached from the uterine wall is lengthening of the cord outside the vagina. Other signs include a sudden gush of vaginal blood. Usually, when placenta detachment occurs, the uterus becomes more firm and changes in shape from discoid to globular. This process takes about 5 minutes. If the placenta does not separate, manual removal may be necessary to prevent postpartum hemorrhage. The nurse is managing care of a prima gravida at full term who is in active labor. What should be included in developing the plan of care for this client? 1. Oxygen saturation monitoring every half hour. 2. Supine positioning on back, if it is comfortable. 3. Anesthesia/pain level assessment every 30 minutes. 4. Vaginal bleeding, rupture of membrane assessment every shift. The correct answer is 3. The nurse should monitor anesthesia/pain levels every 30 minutes during active labor to ascertain that this client is comfortable during the labor process, and particularly during active labor when pain often accelerates for the client. When in active labor, oxygen saturation is not monitored unless there is a specific need, such as heart disease. The client should not be on her back, but wedged to the right or left side to take the pressure off the vena cava. When lying on the back, the fetus compresses the major blood vessels. Vaginal bleeding in active labor should be monitored every 30 minutes to 1 hour. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The father of a neonate scheduled for gastrointestinal surgery asked the nurse how newborns respond to painful stimuli. Which of the following should be the nurse's best response? 1. Newborns cry and cannot be distracted to stop crying. 2. When faced with pain, newborns try to roll away from it. 3. Newborns typically move their whole body in response to pain. 4. Pain causes a newborn to withdraw the affected part. The correct answer is 3. The neonate responds to pain with total body movement and brief, loud crying that ceases with distraction. After the age of 6 months, an infant reacts to pain with intense physical resistance and tries to escape by rolling away. A toddler reacts to pain by withdrawing the affected part. The parents of a child with a tracheoesophageal fistula express feelings of guilt about their baby's anomaly. Which of the following approaches by the nurse would best support the parents? 1. Helping the parents accept their feelings as a normal reaction. 2. Explaining that the parents did nothing to cause the newborn's defect. 3. Encouraging the parents to concentrate on planning their baby's care. 4. Urging the parents to visit their newborn as often as possible. The correct answer is 1. The parents of children born with defects often have feelings of guilt and ask what they might have done to cause a condition or how they might have avoided it. It is important to allow parents to express their feelings and to accept these feelings as normal reactions. Explaining that the parents are not at fault would not be appropriate until they have dealt with their feelings of guilt. Encouraging long-term planning generally is of little benefit to parents who are emotionally distraught. Additionally, the parents may interpret this as ignoring their feelings and confirming that they played a role in causing their child's anomaly. Urging the parents to visit their infant as often as possible would generally be of little help and could appear to the parents as though they are being talked out of their feelings. A nurse received the taped change of shift report for assigned clients and prioritizes client rounds. In what order should the nurse assess these clients? 1. A client with an endotracheal tube transferred out of the intensive care unit that day. 2. A client with type 2 diabetes who had a cerebrovascular accident 4 days ago. 3. A client with cellulitis of the left lower extremity with a fever of 100.8 degrees Fahrenheit, 38.2 degrees Celsius. 4. A client receiving D5WIV at 125 milliliters per hour with 75 milliliters remaining. The correct order is 1, 3, 4, and 2. Because two major complications of endotracheal tube intubation, inadvertent extubation, and aspiration, can be catastrophic events, assessment of this client is a first priority. Cellulitis is a serious infection as there is inflammation of subcutaneous tissues. Third spacing of fluid may promote the formation of a fluid volume deficit, which can be exacerbated by the fever due to insensible fluid loss. The nurse should assess this client next to determine current vital signs and fluid status. The nurse should assess the client with the IV fluids next because the new bag of fluids will need to be hung in 30 to 40 minutes. IV therapy necessitates that the client be assessed for signs and symptoms of adequate hydration, and the IV access site needs to be assessed. From the information provided, there is no indication that the client who had the cerebrovascular accident is unstable. Thus, this client is the last priority for assessment. The nurse has placed the intubated client with acute respiratory distress syndrome in prone position for 30 minutes. Which of the following would require the nurse to discontinue prone positioning and return the client to the supine position? Select all that apply. 1. The family is coming in to visit. 2. The client has increased secretions requiring frequent suctioning. 3. The SpO2 and PO2 have decreased. 4. The client is tachycardic with drop in blood pressure. 5. The face has increased skin breakdown and edema. The correct answers are 3, 4, and 5. The prone position is used to improve oxygenation, ventilation, and perfusion. The importance of placing clients with ARDS in prone positioning should be explained to the family. The positioning allows for mobilization of secretions, and the nurse can provide suctioning. Clinical judgment must be used to determine the length of time in the prone position. If the client's hemodynamic status, oxygenation, or skin is compromised, the client should be returned to the supine position for evaluation. Facial edema is expected with the prone position, but the skin breakdown is a concern. Which of the following interventions should the nurse anticipate in a client who has been diagnosed with acute respiratory distress syndrome? 1. Tracheostomy. 2. Use of a nasal cannula. 3. Mechanical ventilation. 4. Insertion of a chest tube. The correct answer is 3. Endotracheal intubation and mechanical ventilation are required in ARDS to maintain adequate respiratory support. Endotracheal intubation, not a tracheostomy, is usually the initial method of maintaining an airway. The client requires mechanical ventilation. Nasal oxygen will not provide adequate oxygenation. Chest tubes are used to remove air or fluid from intrapleural spaces. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.